Good morning. Myself, Aditi Verma, I have this wonderful opportunity to interview Dr. Jyothsna Bhat. Dr. Jyothsna Bhat is a clinical psychologist specializing in individual, couples, and family therapy. She maintains a part-time private practice in Newton, Pennsylvania. She has over 10 years of experience as a therapist and was a recipient of the 2006 Psychologist for Social Responsibility Award. She recently began work at Children's Specialized Hospital in New Jersey, where she not only provides therapy for children, but also conducts full standard battery psychological assessments for children with chronic medical issues who are experiencing emotional and behavior problems, as well as children with pervasive development disorders such as autism. Among her areas of expertise are depression, anxiety, childhood problems, and couples and family therapy. She is constantly finding ways to give back to the community. Some of the ways she has already given back is by participating in free medical fairs locally in Trenton, New Jersey, disaster relief work in Mississippi and Haiti, and she continues to mentor youths in transitional living in Trenton. She has given workshops and talks on the importance of mental health and enjoys participating in advocacy for psychology. Welcome, Jyothsna. I'm so excited to have you here. Just introducing you gives me such positive energy.
Thank you. Thank you so much, Aditi.
So why psychotherapy, Jyothsna? What motivated you to go into this field?
Okay. Well, first of all, I want to say thank you for having me. It's a real privilege to be able to talk about a subject very close to my heart. So I appreciate that.
Sure.
My foray or my journey into psychology was not necessarily a dramatic moment or, that came, suddenly. It took, some time. I was initially swept away into the whole South Asian mentality of, being a doctor and going through the medical pre-med route. But soon in college, I realized that medicine was not my thing. I switched majors halfway through and started taking some psychology classes and realizing that this was something that was very interesting and exciting to me. I began to see that I could help people just as much because I wanted to do something that's service-related, and I realized I could help people just as much, if not more, because a lot of physical symptoms are exacerbated or created by mental health issues.
Right.
So I began to really explore this field by volunteer work, and I saw a spectrum of problems and realized how debilitating our thoughts and emotions can be to our daily functioning. I had a chance to volunteer with a day program for people with schizophrenia. I worked with children in camps that have emotional issues, even children in Montessori's. I worked with a psychiatric unit with adults and adolescents. All of these experiences began to sort of form give me my formative interest in early years, helped me develop my interest in psychology. My most vivid memories, some of them were the more dramatic places that I worked. I was in a special school in Cleveland for children labeled as emotionally and behaviorally disturbed. These kids were throwing things, fighting, and the reason why they were there was because they were not able to be maintained in a regular school district. So once they completed this program, they would go back to that. But they were literally punching each other every day. It was very scary.
That sounds intense.
It was.
Yeah.
But like I said, all of these experiences really, helped shape my work and my exploration in the field. I really began to enjoy the prospect of what this field could bring to my life. So that's kind of where it all began.
Well, that's amazing. So now that you have so much experience in the field, dealing with all different types of personalities, and do you ever feel like it's too much? Because as a psychologist, it's a big responsibility every morning, to get up and show up for these kids and for these folks who have challenges in dealing with simple day-to-day activities or have major emotional issues. So how do you prepare yourself for your day? How do you prepare yourself to, be there 100% with these children? even adults who with all your patients?
Well, that's a really great question, and I get asked that a lot. And initially I didn't have a good answer, but I think because I was still developing it, and I realized that I was creating something for myself, and that is a mental space, sort of an emotional, spiritual space that doesn't allow all of the intensity of the day and the problems that I was helping my patients work through spill into my conscious mind and the rest of my day. So this has been very helpful to me because I realized quickly that I can't be constantly worrying about every situation, every patient 24/7, and it's going to affect me. It's going to make me feel negative. It's going to affect me on an energetic level. It's going to affect me emotionally, and from a work-life balance perspective. And that is not very helpful to my patients and clients because
Absolutely.
they've come to me for that very reason, to be this stable source of strength and emotional support. And if I'm not able to provide that because I've been so stressed out about their issue and so emotionally invested, then I'm better off being like a friend or another family member. You know what I mean? That it just doesn't make sense.
Yeah.
So that space has really helped me, kind of deal with that, just giving a little distance. And that actually has given me the strength to get back every day to what I do. It helps me not get burned out. I'm not saying I've got it all the time, but it definitely has helped me. It's a great thing to have, and I feel like I've been very fortunate to create this for myself just because of my own, I think it's my own spiritual strivings or, we all have some anchors that we go to, and for me, spirituality is my anchor, and that kind of has helped me create this space.
I totally feel you there. I totally feel you there because spirituality is my anchor too, and it's amazing how you just mentioned just making that a little bit of difference, like giving yourself a little bit of space. You can make such a big difference for your patients.
A little space, a little emotional detachment goes a long way.
Oh, yeah.
I mean, obviously there are times when a case has bothered me and, got kind of trying to spill over into my, we're normal, we're human. But I realized that I didn't have to take on that level of intensity. And I can look at it more like an observer sort of, thing. And not that I'm going to remove myself from an empathy or compassion perspective. It's not a cool detachment. It's more of like a loving, non-judgmental detachment.
Yeah.
So that's kind of where
that definitely makes sense.
Yeah, it's like handling our own issues, right, on a day-to-day basis. Yeah. If we were caught up in every single issue that we were thinking about, we would be in trouble. I think most of us have learned how to compartmentalize issues.
Yep. That's great. That's great. We have been talking about psychotherapy, and from your experience, it sounds like it's such a wonderful tool to help people. But a lot of people don't even understand what that means. So, could you please take a moment to explain what it is, what psychotherapy is, what is involved, and why is it important?
Sure. When I was young, I think I had sort of a naive explanation because I was still exploring the field, and I thought I was, I'm going to be a therapist, and I'm going to, and my whole meaning was I'm going to heal people with words, and while that was really cute, and okay, that's really nice. I think I gave that in some interview as an answer, and I thought it was the coolest thing ever, but. Really, sure, that's part of it, and maybe there is a profound meaning to that. But I think for me, I realize now that psychotherapy to me is the facilitation of profound shift that can occur in a person that results in an inner healing and an ability for that person or that individual to then act from a newfound space of empowerment and self-confidence. That to me is the hallmark of psychotherapy, helping a person get to that place. And obviously it's the use of verbal communication to help bring about a change in a person's maladaptive thinking. We use the word maladaptive thinking, meaning the thinking, the thoughts are not helpful. Mal is like usually bad or means like in Latin, not, so bad, quote unquote, bad thoughts. Yeah.
Like negative thoughts.
Negative thoughts, I don't want to say bad, but negative thoughts that don't help a situation. So we're helping them change those thoughts, and sometimes changing a person's environment too. There's, and I'll get into that when we talk about tools, but there's that whole, dynamic going on as well. But that's kind of what I feel psychotherapy to me is.
So that's great, because the key thing is that helping a person change their perspective or figure out what are the things they need to change that so they can be more of a positive person, and that is really the key for them to keep going in life and do the daily day-to-day tasks and interact with other people. So the psychotherapy is like a big is a big I guess factor that can help, or a tool, or a big key process that can help them if they're not able to handle it by themselves.
Exactly. Yeah, I mean, and you're right. It's a process, which I like the way you put that. But between the therapist and it's a journey. To help bring that out.
That's just so as we talk about this, and to help normal people understand this even more, is it possible? Can you give some specific examples of what kind of people come for psychotherapy? Because when people just listen to the word, I think some of the people just. I don't want people to think that it's just something for the psychos out there, because that's not what it is. That is what movies and television shows have made us believe. So we want to remove that myth with some real-world examples. So if you don't mind sharing some real-world examples of the type of people who have come to you for help, that would, I think, help normalize the idea.
Yeah, I think that's a big misconception. And maybe it's slowly changing, but I know maybe on the coast and things like that, as people, it's almost like mode or trendy to have a therapist in the higher profile circles. But one of the things that you said, normal people, I don't think there is such a thing as normal. That's something that we talk about in psychology all the time. I think we all have something that's quirky or different, or that makes what is normal, right? There's no such thing necessarily as normal, abnormal.
But I totally agree. It makes sense. It makes sense,
right?
Because sometimes I myself feel that I'm not normal. So you're totally right.
Exactly. Half the time I know I'm not. So, but but like I said, when I was first coming into the field, I got to see a spectrum of issues, of people from schizophrenia to severe depression to phobias and things like that. But then I also got to see a diverse group of people, like from all walks of life, whether they were Indian American, from India, or like from the islands, from Europe, or regular American folks, dealing in all kinds of class levels. I mean, all kinds of professionals, white collar, blue collar. We have people I've treated so many doctors and doctors' families. We've seen lawyers, airline pilots, air attendants, CEOs, in my private practice as well. And it's not all, quote unquote psychotic, kind of behaviors. And psychotic means, literally that someone is disassociating or removing, they're losing touch with reality. Let's put it that way. And not everyone, when you're losing touch with reality, maybe you're hearing voices or you're seeing things or you're believing something that's truly believing something that's not true, almost and deluding yourself in a way. Not everybody experiences those kind of issues, are seeing therapists. And a lot of times they're beyond our scope. They may go to a psychiatrist. But as far as regular problems out there, and my marriage is not doing well. My child doesn't listen to me on a daily basis. Or I want to improve myself to be more ambitious, or I feel I'm too shy. I want to be more social. Like simple problems that we all can experience on a daily basis. Or, I just lost my job and I'm a complete wreck. I could use some support. These are the kind of things. Or my father just died. My dog just died. These are the kind of things that people come to therapy for. And it does not indicate that, these people cannot handle their problems because they're, quote unquote weak. It actually takes a lot of strength and a lot more, self-confidence to be able to take this problem and say, let me take it to somebody who can give me a non-biased support on this and really get me through this tough time. It does not mean that you are incapable of handling your problem. It's saying you're capable of handling it in the right way because you're realizing that your own mind may not be, helping you. It may be making things worse, or you may not be surrounding yourself with the right people.
Very wonderfully put, though, Jyothsna. Very wonderfully put when you said that you're capable of handling it the right way, because that's where that this is where I need to go to really grow myself in this area of life, or
go ahead. Sorry.
No, that's okay. Go ahead.
I was just going to add a quick plug about South Asian, the Indian population, South Asian population. This is a real growing issue in India as well as the States, and I get a lot of patients that come in for a short period of time, but are kind of nervous about taking this, this plunge with a therapist. And, I get a lot of calls from family, friends, and their kids are having troubles and, and worrying about, is this such a bad thing? Is this going to be something they're going to deal with for the rest of their lives? And, I think the more and more people realize and come to therapy and realize that it's not that bad. It's actually something that's really helpful, and it doesn't have to be hidden in a closet. It's just like having a medical issue. For some reason, when it comes to the mental area, people feel like that's taboo to talk about, and it means that somebody's, airing out dirty laundry, or they're weak, they're not able to handle, and that's just not true, You're going to a doctor to help you with those things, or you're going to a therapist to help you with those things, just as you would go to a nurse practitioner or a doctor for your medical issues.
I totally agree because, in South Asian community, the concept of emotional, they are very much focused on being smart, being intelligent, IQ, and the importance of emotional and mental health is something that needs to be, educated to them. Like that area needs more awareness, and they are holding back on it, and this is a growing problem there. Hopefully over the years, this will resolve. In the past, I think even going to the doctor for issues like cough and all required, there was resistance, right? Like several years ago, many years ago. And now everyone goes to the doctor if they have a cough or if they have any illness. But now for the mental health issue, I think that's the idea of that is not yet out there, and that at least in the South Asian communities, and I think it's slowly is going to change because now people are actually even at least talking about it. So that's definitely a good point that you bring up there.
Yeah, I was really at my last trip to India, I was fortunate enough to address in a university in South India. I was able to, all-girls college. I was able to address mental health because they asked me to come there and speak, and it was amazing. I was like, it was the most exciting talk because I feel like all those girls were studying to do something in psychology, and that was and that's when I think it was Deepika Podakone. Somebody came out, I forgot who it was, and said she had been depressed. I forgot the name of the actress, but she'd come out to the public to say she'd gone through depression. And it was right on the heels of that, and it was a very exciting time to be talking there. But anyway, not to go off, I wanted to make the point, and I think, it's important that not just South Asian communities, but I think just communities, maybe underserved communities and people that probably could use this help don't always come because of these walls they've put up or these, the taboo nature of psychology. But I think over time and generations, I'm hoping that this is getting better. But
Yes. So, just kind of segueing into the emotional issue, that we were talking about. The majority of these emotional issues start happening, or it seems like they start cropping up, like majority of them in children when they hit puberty. And these days they're hitting puberty earlier and earlier, right? I guess they are as early as age 9 or so.
Yes, yeah.
So what tips do you think you can provide for parents to prevent this or catch this early on? So parents can be supportive for their kids, because that is very important, because these children are still very little. 9 years.
Yeah, I mean, you're right. Growing. Yeah, puberty is happening, earlier, exactly. Like girls are menstruating early, even at 9 and 10. And it's scary. They're growing up.
Yeah, that is.
Yeah, and interestingly enough, in middle school is the time, coincidentally, that mental health issues crop up as well. And this kind of goes right with the puberty time. And sometimes those issues last along with the puberty and then go away because mood swings happen in puberty, and sometimes they linger because there's more of a mental health issue happening. I think the main stuff that I have advised with parents is open communication, education, like using books on puberty and just using open communication, how to express, give children words around what they're feeling. There's some books out there like Ready, Set, Grow. I don't remember the authors, but My Body, Myself series for girls and for boys. These break down what's happening in very simple terms as far as from a puberty perspective. It helps kids put words to their emotions. Like the earlier they learn about some of these things, like the more empowering it can be. I think watching for signs of withdrawal or, excessive crabbiness, or just, abnormal behavior that sometimes when you go to a doctor and they'll say, it's expected, it's puberty right now, or they're going through puberty, these are things you're going to see. But then if these linger or persist or kind of get in the way of their daily functioning, they don't want to go to school, or or they're consistently not wanting to go to school, or they're consistently saying my tummy hurts, and usually my tummy hurts doesn't necessarily really mean my tummy hurts. There may be something else going on. Or aches and pains are often manifestations of some sort of moody feeling. Not always, but sometimes. That's how kids know. They know that if they say that, then they will be taken seriously. So what you could say is, what you could help them learn is that sometimes we don't always feel good inside our minds or in our, explaining about what sadness means, and explaining how that sometimes when we feel angry, we're actually feeling sad inside, and what could that be about, and helping them talk about it and state those feelings. And obviously, if they continue to get worse, you want to take them to get some help. Some kids are just straight up start acting out in big ways, tantruming for very long periods of time, destructive behavior and that kind of thing. So obviously you want to seek services at that time. But with the kids that that are just regular, developing, going through the development and all that, and if they start to hit some emotional issues, you definitely want to, use some educating, use some normalizing, tell them, I understand it's a tough time right now and you're going through a lot of different changes in your body and your mind, and it really helping them to understand that the mind is also an active participant in their development. So what they feed their mind, what their mind tells them, can also, create, physical manifestations in their body, as well as, help them feel better or worse.
Yeah. That's a very important point also, because emotional awareness is really understanding what you are feeling, and also where you're feeling within your body. Because I was asking my son, what makes you angry? And he goes, if you don't let me play the video game. And I was like, where do you feel it? Because when I read about it, even I didn't know where I felt it. And I asked him, where do you feel it if you think about that? And he was like, I feel it in my head. And I realized that I need to figure out, where do I feel it when I get angry? And those are such. Now I know, where does he feel it, right? If sometimes he says I have a headache, I have to. It's not just the heat or something. There are some emotional issues that I need to work with him on.
Right. So, and sometimes, like through storytelling or just like art projects or different things with kids, you can help them just kind of express themselves more. That's kind of a nice thing, If kids don't like to verbally talk, sometimes just giving them some outlets with other kinds of crafts and stuff, I think, is another way for parents to help their kids, express some of the stuff. But like I said, if it starts to get to a place, and educating, if it starts to get to a place where it's interfering, that's when you want to seek professional help.
So talking about professional help, can you talk about the different tools that you use as a therapist to help your patients, and when does medication become necessary?
Okay, so just quickly, the tools that I generally use there's a few of them, and they all come from what we call theoretical orientation. So there's theories behind all the different tools and philosophies behind the research theories, I should say, that have been used for all these things. But some of the things that I use in my mental health toolbox are cognitive behavioral therapy, which is the number one treatment for anxiety and depression from a psychotherapy perspective. It's the idea that, our thoughts, our emotions, and our physical manifestations or physical symptoms are all intertwined. And can all impact each other. A quick example of this is when you look at a sunset, Aditi, what might you feel inside?
Beautiful.
Okay, so you might see that. Somebody might say that, and then inside your body might start to relax. You might have a thought like, wow, and I feel really good right now. I have another person who looked at that and thought immediately, oh, God, that means my night shift for work starts. I'm not excited. I don't feel good. Like it was a nurse. Like, oh, God, here we go. Like work starting, blah, blah, blah. So and she felt tightness in her body, right, in her shoulders. So it's that idea that all our thoughts and our feelings and our emotions are all feeding into each other on all different levels. So that's one big one. Then we have strengths-based, and that's basically where I look at what's your strength? Ask them what their strengths are. What are they bringing? Are you determined? Are you a good writer? Are you, skilled at, art? Or are you a soccer player? Are you friendly, generous, a problem solver? And then I say, how can we bring that to your treatment, of a problem? So if you're an artist, that means you might have a good way of visualizing your problem. You could bring that skill of visualizing and how to kind of, work through it from a visual spatial ability. So there's some strengths are a great way to help people feel empowered as well, even in the first session. I use interpersonal or system theory, basically like how do they see themselves in relationships. And then sometimes from a systems perspective, I bring people in. Like I'll tell them, bring your family members. Let's see what this dynamic is all about, because it's not necessarily all happening in the person. There may be some environmental stuff that's affecting that person, and helping them deal with their own reactions, but helping other people see what they can do to create a change in the system, all in order to help the child or the clients involved. And then mindfulness is one of my favorite things that's been obviously used now over 20 plus years. John Kabat-Zinn is like the mindfulness guru especially for adults and in the psychology space. And it's the idea of bringing your patients or bringing yourself into a present moment, accepting with compassion and non-judgment of every thought and every action and every feeling that you're having, but not succumbing to them, not fueling them, not more like giving that distance and watching those thoughts, so that eventually you're the one in the driver's seat, not your thoughts. And for kids, Dan Siegel is the guru for mindfulness in children, which is really nice. So those are my tools.
Oh, no, that's great. They sound amazing, especially the mindfulness one is intriguing. 'Cause I was trying to. They have this apps for body scan mindfulness, and and I was trying to do that with my son at night, so we could do something together to help him be a little bit more.
No, absolutely. It's great with kids that you mentioned that. Like, I know that they are trying in some California schools, and I do it in my volunteering with the teenagers that I work with, like just helping them get quiet for a little while and kind of leading them through some breathing, or just like helping them like be in a space that makes them feel really good and mindful of that space. That's great that you're doing that. I did want to add, you asked me about the medication piece. When does medication become necessary?
Yes.
Yeah, medication becomes necessary when behaviors are creating, as I said earlier, a real significant distress in the child's daily life, interpersonally, academically, or at school, or like just in their overall functioning. When it becomes, like, for an instance, a child came into my office that had severe ADHD, where you would call her name over and over and over, and she would look at you for a minute and then again is back to doing something. And her parents are basically screaming at her, going, pay attention, pay attention. It's like the poor child, she can't. She can't. So we can only, and then go get this or go get that. She's lost. She goes to one thing to do it. She's doing 5 other things along the way and has completely lost what she's supposed to do. And she's getting in trouble for that. And it's like, you cannot, that's where it's not fair to not give her something more. We tried 3 months of therapy or 4 months of therapy. They tried a few things. The school tried a few things we recommended, and with some results, but not enough. I mean, she's still struggling. So that's when I said we have to now look at medication.
I see. Okay.
Once they started doing that, it made a world of difference. The child is doing so much better, just like focusing and able to stay with you for, a much longer period of time. School is improved. They don't have to do as much cueing anymore and reminding. Teachers really can make a huge benefit. Obviously, there's things that parents fear, which are side effects and different things like that, and that's when you should definitely ask a billion questions to the doctor who's prescribing. And hopefully it's a person who has a specialty in child psychiatric, because medicating for children and adolescents is very different than medicating for adults. And that is really important to take into consideration when you're looking for medication support.
Okay. Thank you for that. Just talking about the medication and then therapy session, I wanted to talk a little bit about, what sort of support and help people can get as far as the cost is involved. So because a lot of people are worried about the cost, and they may avoid going to the therapist to get help in this area, which is very important to do to get the help. So what can you talk about? Does insurance cover the therapy sessions, and what sort of help they might already have that they may not be aware of?
Yeah, I mean, most insurances should provide mental health coverage. I know the Affordable Care Act is kind of instituted this in their coverage plans. They should also be receiving preventative health care, such as coverage for depression screenings and different things like that. But for substance use and mental health disorders, there should be coverage in most plans. If you don't, and hopefully you're being covered by something at this point through the Affordable Health Care Act, because that's what it's for. It's to give people coverage. But if you, for some reason, do not have coverage, or you're on Medicaid or something, going to your local community mental health centers, which you can Google by just looking up your state. And like, for instance, New Jersey, you could look up New Jersey mental health, and a million local associations come up, like the New Jersey Association of Mental Health, the National Association of Mental Illness in local area. So there's a National Association of Mental Illness like organization, which is full of resources for people with mental health issues or who need services for their families or friends or whatever. They can direct you to a local chapter or local organization, and the local organizations, I think, would have lots of resources and possibly, you can get case management services, and they would be able to work with you on that piece as far as like affordability and that kind of thing. And obviously, if one organization doesn't work, there's others you can try. Some of the community mental health nonprofits often have, some sort of system where they cover people that don't have the money to cover the services, whether it's for medication or therapy. Especially for. Yeah, go ahead. Especially for like substance.
I think that's good to know that people who have insurance and Affordable Act, they can call their insurance and see what is covered, what's not covered, and then I guess the first step is to find a therapist to go to. But people who don't have that, they can start by trying to find a local organization, community, local state. Organization, and see if they have any resources or they have any programs to help them.
Yeah, you could also contact like the American Psychological Association, that is online, or APA.org. You can also and contact NAMI, I think it's .org, NAMI, and these larger organizations can help you connect with local like chapters and states, and there's a bazillion numbers and people to call. I know this is for I'm thinking a national audience, so I don't want to just say the ones in New Jersey, or there's PA, there's everywhere. So if you just Google, even if you don't have Googling services, if you can go to your local library and look that up, you can find lots of things, lots of information online. But I would recommend, if you have a doctor, I would also recommend who they have that may be able to afford, they may be you can afford, they can probably help you hook that way. Your insurance panels can help you if you have insurance. Otherwise, and there's also private practices with sliding scales or pro bono work that you can look at.
That's great. Thank you so much, Jyothsna, for all the wonderful information. I truly believe that now our listeners are more comfortable with the term psychotherapy and what it involves, and hopefully they'll be able to go and get help as needed. Really appreciate your time in talking about this topic.
Thank you so much. It was a real privilege.